The Senate will please come to order. The senator from Windsor is recognized for a report.
We have exercised our duty and the governor's office is fully informed.
Thank you, Senator. The senator from Windham is recognized.
Thank you, Madam President. I move to suspend the rules and not refer S1 to committee and take up for immediate consideration.
The senator from Windham has moved that the rules be suspended and S1 be taken up for immediate consideration. We have on the calendar for action S1 introduced today. Please listen. We have on the calendar for action S1. Please listen to the first reading of the bill.
Madam President, my mistake. Madam President, I move that the rules be suspended and we take up a resolution for immediate consideration.
Thank you, Senator. The senator from Windham has moved that the rules be suspended and SR4 be taken up for immediate consideration. Are you ready for the question? The senator from Caledonia is recognized.
Point of clarification, Madam President, I heard the senator say that we take up a resolution. I heard the president say specifically S4. I just want to make sure we're all on the same page. Is it S4 we are now taking up? Was that the intent of the pro tem?
Thank you for the question, Madam President. Yes, that was the intention.
We will now take up S4. And again, the question is, shall the rules be suspended and S4 be taken up for immediate consideration? The senator from Chittenden is recognized.
Madam President, I think folks deserve clarity who are watching at home. It's a resolution, so I believe we're taking up SR for Senate Resolution 4 at this time.
That is correct, SR4. Are you ready for the question?
Point of information, Madam President. Has S4 been distributed to the members so that we know what it is we're voting on?
Are there any senators who do not currently have a copy of SR4?
Correction, Madam President, I have a copy of SR4, and my question is, has that also been distributed to those senators who are present virtually?
If there are any, it has, and it should be in senators' mailboxes. It should also be posted on the, soon be posted on the Senate webpage. The question is, so the rules be suspended and SR4, Senate Resolution 4, be taken up for immediate consideration. Are you ready for the question? All those in favor, please unmute and say aye.
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 Those opposed, nay.
No.
The ayes appear to have it. The ayes do have it, and you've suspended the rules, and now we'll take up S4 for immediate consideration.
Madam President, I was requesting a division.
The senator from Franklin has requested a division.
Madam President,
Yes, the senator from Chittenden is recognized.
point of information, you, I thought, ruled that the ayes had it. Is it permitted to go back and re-vote the question?
As the senator from Franklin had requested a division, I'm going to ask for some patience today. We have senators in the chamber. We have press in the chamber. We do have more noise. We have senators on Zoom. So we will move forward with a division.
Thank you, Madam President.
A division has been requested by the senator from Franklin. We'll kindly ask that all senators supporting the suspension of the rules, please stand. And this goes for our senators on Zoom. You may be seated. We have 22 members. On all those opposed, please stand. Thank you. Senators, thank you for your patience. Please listen to the results of the, and you can also sit down. Thank you very much. We have our first division today. Please listen to the results of the division. The ayes 22, the nays 6, and you've suspended the rules.
I'm sorry, Madam President, but I believe in our roll call, we had 27 senators and your addition is 28, which is a little concerning.
I think that's
Perhaps somebody joined us late, but
We had,
thank you.
Okay. Thank you, Senator. And again, we do have senators on camera in the chamber, on camera at home, and we did have one double count on the senator who was both on camera in the chamber. And so please listen to the results of the division. The ayes 21, the nays 6, and you've suspended the rules and will now take up SR4 for immediate consideration. We have a resolution to take up at this time, SR4. Please listen to the reading of the resolution.
SR4, Senate Resolution urging Governor Philip Scott to use all possible public health measures to reduce the number of COVID-19 cases and associated deaths and maximize vaccination rates among all eligible population groups. Whereas within days of the first detected COVID-19 cases in Vermont, Governor Scott issued Executive Order number 01-20, quote, the declaration of state of emergency in response to COVID-19 and National Guard call-out, end of quote, initiating a series of actions across Vermont to reduce the spread of the disease. And whereas since the start of the pandemic, Governor Scott has continuously stressed that Vermont's response to COVID-19 is based on data and science. And whereas on July 24, 2020, Governor Scott issued Addendum 2 to amended and restated Executive Order number 01-20, mandating that face masks be worn in all indoor and outdoor public spaces whenever close contact with others was unavoidable. On April 30, 2021, the governor issued Addendum 15 to amended and restated Executive Order number 01-20, rescinding the portion of the mask mandate applicable to outdoor public spaces. On May 14, 2021, the governor issued Addendum 16 to amended and restated Executive Order 01-20, rescinding the indoor face mask requirement for vaccinated individuals. And on June 15, 2021, the governor issued Executive Order number 06-21, marking the end of the state of emergency and addressing, quote, post-emergency recovery activities, end of quote. And whereas the Center for Disease Control and Prevention and the findings of numerous studies indicate that wearing a mask is effective in reducing the spread of COVID-19, both by reducing the emission of virus-laden droplets by symptomatic, asymptomatic, and pre-symptomatic individuals, and by reducing the likelihood that a wearer will inhale infected droplets. And whereas the far more transmittable Delta variant is now driving the surge in COVID-19 cases, hospitalizations, and deaths in Vermont and around the globe. And whereas despite Vermont consistently having one of the highest vaccination rates in the United States, the state now also has one of the highest per capita rates of COVID-19 infection. As of November 19, 2021, the daily average number of new COVID-19 cases in Vermont has increased 45% over the prior 14 days to 352. On November 11, 2021, a record 591 cases were reported. And recently, the testing positivity rate has been in excess of 4%. And whereas on October 25, 2021, the Center for Disease Control and Prevention updated its masking guidelines, recommending to fully vaccinated individuals that, quote, to maximize protection from the Delta variant and prevent possible spreading it to others, wear a mask indoors in public if you are in an area of substantial or high transmission, end of quote. And whereas as of November 19, 2021, the Centers for Disease Control and Prevention identified the entire state of Vermont as an area of high transmission. And whereas pursuant to 20 VSA Section 9, the governor is authorized to declare a state of emergency in response to an all hazards event, including a health or disease-related emergency, quote, that causes or may cause substantial damage or injury to persons or property within the state, end of quote. And whereas the COVID-19 crisis in Vermont has dramatically worsened, and more effective state government responses similar in scope to those implemented during 2020 must be adopted without delay. Therefore, be it resolved by the Senate that the Senate of the state of Vermont urges Governor Philip Scott to use all possible public health measures to reduce the number of COVID-19 cases and associated deaths and maximize vaccination rates among all eligible population groups. And be it further resolved that the Senate of the state of Vermont urges Governor Philip Scott to increase testing capacity throughout the state. And be it further resolved that the Senate of the state of Vermont urges Governor Philip Scott to expand access to free or low-cost rapid testing options. And be it further resolved that the Senate of the state of Vermont urges Governor Philip Scott to provide stronger guidance and support for schools and healthcare providers. And be it further resolved that the Senate of the state of Vermont urges Governor Philip Scott to direct the Department of Health to post on its website and update daily the COVID-19 case rate for each town and the degree of communication transmission in each county using the Centers for Disease Control and Prevention guidelines, and to make the information readily available on the department's COVID-19 dashboard and easy to navigate. And be it further resolved that the Senate of the state of Vermont urges Governor Philip Scott to declare a state of emergency based on the high rates of community transmission of COVID-19 in this state, to be followed by a statewide indoor masking requirement. And be it further resolved that the Secretary of the Senate be directed to send a copy of this resolution to Governor Philip Scott.
Thank you. Now you've heard the reading of the resolution. The question is, shall the Senate adopt the resolution? Are you ready for the question? The senator from Franklin is recognized.
Thank you, Madam President. I do not believe that this resolution is necessary. We've trusted Vermonters throughout this pandemic to do the right thing, and they have. We have the highest vaccination rate in the nation. And COVID is, yes, an issue that is endemic throughout our country. But at the same time, we have among the lowest hospitalization rates in the nation and among the lowest death rates in the nation. Of those states that have had these kinds of mandates in place, Vermont has had lower hospitalization and death rates through the Delta wave than most, not all, and there are only 6 states that have such mandates. Again, I believe that this is a resolution that attempts to micromanage a health conflict, a health issue, when we have a health department that has done an outstanding job in managing it thus far. Yes, there's an issue of personal responsibility in all of this, and Vermonters have shown remarkable personal responsibility based on the fact that more than 80 and approaching 90% of Vermonters are already vaccinated. They've done the right thing. I trust them to continue to do the right thing. And I do not believe the heavy-handedness associated with this resolution is necessary for that to happen. Thank you, Madam President.
Thank you, Senator. Are you ready for the question? The senator from Addison, Senator Bray, is recognized. And I recognize there are other senators with their hands up, and we will get to you.
Thank you, Madam President. I am using the legislative website. I appreciate the Senate Secretary reading it, and I'd seen an earlier draft, but it's a long document. And I think it'd be helpful to make sure that people also have a copy available to them.
Excuse me, Senator, I'm going to ask that if you're not speaking, to kindly mute, just so we have a clear feed. You may continue, Senator.
Yeah, so in using the legislative website, I've looked in a variety of places, been unable to find the resolution, and I'm wondering if we can be directed to where that can be found, especially for people following who have not seen it in any form yet.
Thank you, Senator. I'm going to briefly confer with the Senate Secretary. I've been informed that the resolution SR4, for those listening, is now posted on the Senate overview page. If you're at home and you haven't seen it yet, please refresh, but it should be posted there. The senator from Rutland is recognized. Kindly unmute.
Thank you, Madam President. I just need a clarification. In the 6th whereas, I believe I heard the secretary say that the increase is 25%, and I'm reading in the resolution that it's 45. Just to clarify that that's what the number is.
Senator, just to confirm, we are in the 6th paragraph that begins, despite Vermont consistently having one of the highest vaccination rates in the United States. And then in the 3rd line, the daily average number of new COVID-19 cases in Vermont had increased 45% over the prior 14 days. Is that the section you're referring to?
It is, Madam President. I don't know if I misheard the secretary. I thought he had said 25 and was just clarifying that it's 45.
I think the point of clarification is well accepted. Thank you. Are you ready for the question? The senator from Addison is recognized.
Thank you, Madam President. With all due respect to my colleague from Franklin, I believe that this resolution is in fact necessary and it is not heavy-handed. I think we all in this room and throughout our state are proud of the response that we have had to the COVID pandemic since March 13th, 2020, when our governor declared a state of emergency and rightly so shut down the state and imposed restrictions and public health measures to protect the people of Vermont. Our state has done an incredibly admirable job, and we've done so without politics and with community response and support, and with an entire effort from everybody involved. And I am proud, and I believe that all of us are proud of that effort. And we thank the governor for his efforts throughout the pandemic up until July of 2021, when he released all of his restrictions and we were hit with the Delta variant. And since that time, the response from our state has not been equivalent to where we were prior to this pandemic, when we had the best response in the country to the pandemic, one of the best responses in the world to the pandemic. But since then, we've had high case rates, we've had increasing chaos. Our schools have not been well supported. They have not had the testing. They have not had the guidance that they need. And I can tell you, as a mother of 2 children in our schools have been struggling greatly. The administration has not stepped up in the way that they had before. And this resolution is asking them to step up and do the things that they need to do to protect Vermonters. I know that we'll be taking up a bill later that will have a very, very narrow focus on the protection of some Vermonters in some towns. But what we need is a statewide response. And we need our executive branch, our governor, and our Department of Health to step up and protect the people of Vermont when we are facing the most challenging and difficult time of the pandemic in Vermont. Thank you, Madam President.
Thank you, Senator. Are you ready for the question? The senator from Caledonia is recognized.
Thank you, Madam President. Madam President, first, by way of a point of order, I'm disturbed when one of our colleagues said he did not have the document in front of him that we were about to vote on. And I would first like to make sure that all of our colleagues in the virtual world do in fact now have the document in front of them. I don't know how we would confirm that other than asking perhaps for a thumbs up, but I want to make sure everyone is on the same page.
I'm going to briefly.
It was me.
I understand from the Senate Secretary that the resolution was both emailed out to all senators and is now available on the Senate overview page. What I would ask is that if you do not have access to the resolution now, to kindly raise your hand. Is there anything further, Senator?
Yes, but not on that point of order. And I thank you for taking the time to acknowledge that everybody has this document in front of them. Madam President, a long time ago, I was impressed on a day when a House member was bringing her family into this chamber and explaining to them that we, the Senate, are the more deliberative of the two bodies. So as I scan down this resolution and I see the words, the COVID-19 crisis in Vermont has dramatically worsened, I think it is incumbent upon us to understand what is the metric we are using to make that statement. And it occurred to me after reading several emails that have been sent to all of us from the Department of Corrections, probably what most of us don't bother getting into the finer details on because we may not be in the loop of the Department of Corrections. But what a wonderful opportunity to find statistics that speak very loudly about the state of the crisis. We all received a document on the 18th of November, that's last Thursday, and much of what I'm about to refer to is related to that date because that was the point where I got this letter and started to ask more questions. May I quote from
You may.
the document from the Department of Corrections? The Vermont State Prison in Newport is in full lockdown amid an outbreak of COVID-19 cases. 14 cases have been detected, bringing the total to 18 among inmates and 7 in staff at the Northern State Correctional Facility, the Department of Corrections said Wednesday. Meanwhile, the number of cases at the Northeast Correctional Complex in St. Johnsbury has declined. 19 inmates and 4 staff members who had COVID-19 have been medically cleared. Now, there is just 1 inmate case and 2 staff members who are positive. Currently, statewide, 20 inmates and 12 staff in 4 facilities are positive for the illness. the Department of Corrections gives us, pardon the pun, a captive audience for how we analyze our reaction to this disease at this moment in time. And I'm going to get into that a little bit more, but first I want to turn back the clock. When we're making a resolution that says the crisis has worsened, it is worth taking a look at what happened at the beginning of this pandemic. We all remember the news reports of people in the hospital who were dying. We all remember the news reports, not enough personal protective equipment, not enough oxygen tanks, not enough ICU bed space available, not enough hospital bed space available. Those were all things that were worthy and necessitated a declaration of emergency. The governor properly declared a declaration of emergency, and many of us took heat from our constituents for his having done so, but I fully supported that at that point in time. So where are we today in relation to those statistics? I will freely acknowledge, Madam President, that our case transmissions have gone through a roller coaster, and nobody seems to really understand why in a state that now has, as of today, 92.4% of its population 12 and over having received at least one COVID vaccine. That's an important number to think about. 92.4% of our people have been vaccinated. So when I got the statistics from the Department of Corrections, I called up and I said, you know, these are really important that I've been looking at this, and it's an ideal situation in a captive audience because everybody there is tested. But how many of those people are actually showing symptoms? Interestingly enough, they don't have a data point for that. And frankly, I have not seen one from the Department of Health. It would be a helpful statistic to have in hand if one is going to say the pandemic has worsened. But we don't. But what do we have? Hospitalizations. And now I'm shifting to VT Digger, which has a daily count that all of us can read. As of today, there are 56 people who are hospitalized. That's down from 62 on the 18th. Next question. How many ICU beds are occupied as of today? 12, down from 13 on the 18th. It is incumbent upon us as a deliberative body to ask further questions, starting with how many hospital bed spaces do we actually have in Vermont for this population of 640 plus thousand? May I quote, Madam President, from the Agency of Human Services?
You may.
This letter I received from Andrea Delabrie, the Executive Director of the Agency of Human Services, and it was sent to me on the 18th. Senator, following up on your questions about inpatient hospital and ICU beds. The number of hospital beds changes on a daily basis due to staffing and factors including broken equipment, etc. But here are the numbers as of this week. To your question, how many hospital beds are available in Vermont excluding ICU beds? Answer, adult inpatient hospital beds, 991. Question 2, how many ICU beds are available in Vermont? Answer, adult ICU beds, 93. Pediatric ICU beds, 33. And that does not include 10 additional adult ICU beds that were talked about at the press conference last week. So let's take those numbers for a moment. and compare them to our current statistics. 991 adult hospital beds are available in Vermont, and as of today, 56 are occupied by people with COVID-19 related illness. Of the 93 ICU beds for adults and 33 for pediatrics, as of today, there are 12 individuals occupying ICU bed space, down from 13 last week. Why is that important? Because this resolution is claiming that COVID is much worse than it ever has been, and that is not true. We do have a fluctuating case transmission rate. But if that is the narrative we are using to impose regulations on people, it should be incumbent upon us to ask not just who got a transmission, but who actually got symptoms. And of those people, how many ended up in a hospital situation that is now facing a crisis that is worse than March of 2020. We are nowhere near the point of crisis right now, except for that one metric, which has been fluctuating constantly over the past couple of months. And even today is down from where it was yesterday and the day before. So for what reason are we insisting that the governor declare a state of emergency? It's not justified. This resolution is not true on its face. And we have not done our homework, which this deliberative body is supposed to do. The questions are not complicated, Madam President. We have high case numbers of transmission. Of those, how many are experiencing actual symptoms? Of those who are, to what extent is the response? Were they hospitalized? Were they quarantined? Did they go home? Did they stay isolated? The funny part about those guys in the Department of Corrections and ladies, they can't go home. They are isolated. And as the only practicing attorney in the legislature right now who's practicing in criminal law, I speak with these people on a regular basis, and many of the people at Northern State who are in fact positive have been talking with me on the phone on a regular basis. And I always ask the question, are you showing any signs of symptoms? I don't have exact numbers. Some are, some are not. But the answer to getting them back released into the general population is they're isolated for a while. I agree completely with my colleague from Madison County.
Yes, exactly.
Our schools are a mess. Two parts to that question. One she properly raised. The other is the impact and the social interaction our children are facing when they are wearing a mask. And that particular population happens to be the lowest that is impacted by COVID-19. We, as a deliberative body, need to start looking further into this narrative. Because as we present ourselves to the public as reacting to case transmission rates without asking the follow-up questions, we are presenting to a public that we are in a panic mode. And that is a very dangerous thing for this body to present to the public at large. This state is not in panic mode if one gets beyond the question of transmission rates. And let me make a prediction that even the youngest of us in this chamber right now will still be dealing with transmission of COVID at the end of their lives, because we don't have the ability right now to wipe it out. And that's proven by all the people we've had vaccinated, and breakthrough cases still come through. I applaud what the governor has done to push vaccines. I myself am not just vaccinated, boosterated. This morning, I was the first legislator to take a COVID-19 test, and I'm proud to stand here and say, I am negative. That's important. I do think there is wisdom in having supplies presented everywhere we possibly can to have people given the opportunity to take a test, just like all those people in the Department of Corrections who have to take a test. But when I get to the next question about whether we are in a crisis mode like we were in March of 2020, that's just not true. We now have vaccines where we did not then. We have the PPE now stockpiled. We have the equipment that handles oxygen stockpiled. We have ample bed space. We have ample ICU space. And to vote for a resolution that says we are now worse off is just absolutely not true. And it does not present this body in its best light. For that reason, Madam President, I'll be voting no. Thank you.
Thank you, Senator. The question is, shall the Senate adopt the resolution? Are you ready for the question? The senator from Chittenden is recognized.
Thank you, Madam President. I don't know what others were thinking about when we took a moment of silence this morning, but I personally was thanking my God and thanking the strength of our communities that we have not lost a child to COVID-19 in the state. I was thinking about those that are the ward and the charge of our state, and thankful that we had not lost prisoners or others who are under our care in recent days. I was also thinking about the 404 Vermonters we have lost, which is, in my calculation, about 5 Vermonters since we called for this special session. I was also thinking about all of the families in Vermont who won't have a loved one with them at their table for Thanksgiving and for the holiday season. And when I think about that, it's very hard to look at numbers in and of themselves and either celebrate or feel that sense of remorse or what we can do more. All I know is that our main job, when we swear an oath to the Constitution, it's to protect that endowment to life, liberty, and the pursuit of happiness for all Vermonters. And that's what we're here to discuss today. 404 Vermonters is a deep blow to our state in terms of lives lost. And our job is to try and ensure that we attack this pandemic so that no more lives are lost if we can help it. So I rise today in support of this resolution and to acknowledge and express that some of us desperately wanted to do more today. In fact, I might even say somewhat close to a majority of us wanted to do more today. And we compromised because that's what we do in government, to try and meet everyone in our place of shared values, to make sure that we continue to talk about this as being in it together, not as some people are fatigued, some people are looking at numbers about expediency and popularity. This is about how can we stay in this together, not score political points, and work together to get through this long, fatiguing pandemic. No one is experiencing the length of this pandemic more than our children, our educators, our frontline workers, even those who are working in retail establishments and other places of business where they are continuing to wear masks, where they are recognizing that we have to have patience to get through this to protect those who are most vulnerable. If they can have patience, then so can we, then so can our governor. This is a moment to remember what it feels like to support each other and to work to find a compromise that allows a path forward. And all I ask is, for many of us, it was very hard to know that we're putting these decisions that are going to be very emotionally charged on our already beleaguered towns and cities. And yet, what did they say to us? They said, we're ready to rise to the occasion. We know that people will come at us with hostility. We know that people will be upset. We know this decision will be hard. but we want the agency to make that decision to do what's right for our communities. And I don't think that there is anything that represents the best of Vermont more than our towns and our communities saying, please give us the power to help our communities and help those most vulnerable. So I rise today in support of this resolution and to recognize that this is not about popularity. This is not about expediency. This is not about scoring political points. This is about doing what's right. And this is about giving our towns the ability to say that, yes, they are willing to inconvenience the many to save the lives of a few. And I can think of nothing more important that we try to strive for as a civil society and a democracy. Thank you.
Thank you, Senator. Are you ready for the question? The senator from Windsor is recognized.
Thank you, Madam President. I often hear people say that the concept of freedom and unity is a balancing act. It balances individual rights against the rights of the community. I understand freedom and unity differently. I think we have a community based on freedom. We exercise our freedom in a community based on freedom. The common vernacular for that is my freedom to swing my fist ends at your face. Your freedom to swing your fist ends at my face. Another example of freedom is being stated a lot lately in the context of the epidemic, and that is my body, my choice. If I am going to stand up and defend my body, my choice, I am obligated because of the unity part, freedom and unity, to respect your body, your choice. If someone chooses not to vaccinate, it's their body. And they don't have to win an argument to not vaccinate. They simply exercise their right of bodily autonomy. But that carries with it the obligation to respect those of us who do not wish to take their exhalation into our bodies. Masking is not about the person wearing the mask, it's about everybody else. The senior senator from Franklin makes a valid point that we should trust people to do the right thing and that Vermonters have by and large done the right thing. But no one should have to simply leave it up to other people whether or not their rights will be respected or violated. The masking mandate is saying simply, if you choose to be more of a vector than you have to be, take responsibility for that choice. And it's not a matter of respecting or not respecting the people. It's a matter of we, the people, using our government to make rules. In my other life, for many years, I made my living with my guitar. And I mention that because I don't want to invite wisecracks about my being so familiar with closing time at the bars. But I was at the bar on many a closing time. And the standard procedure is that the bartender hollers out to the room, you don't have to go home, but you can't stay here. And all we're saying is you don't have to vax, but you can't casually breathe your exhalation into other people's lives. It is not about disrespecting people. It's about the government doing its job to respect people's rights and to protect people's rights. Thank you, Madam President.
Thank you, Senator. Are you ready for the question? Again, the question is, shall the Senate adopt SR 4? The senator from Chittenden is recognized.
I rise as a newer senator and nervous that I'm breaking precedent or form, but I speak to the bill before us, the resolution before us, SR 4. I also share in the praise for our governor, for our legislature, for every aspect of state government and Vermonters for what we've done during this unprecedented and challenging time. I am not going to support this bill for only one be it resolved, which is the second to last one. I support 90% of this, and I support a statewide masking mandate during these challenging times. I serve on a city council, and I will support requiring masks in our municipality with a later bill. But I do not support the urge for a declaration of emergency. I think that the declaration of emergency is an extreme measure, that we can accomplish this through other means. And I wish those means were accessible to us. And I still urge every Vermonter and the governor to use every mean outside of a declaration of emergency to require masks. But I will not be supporting this bill because I do not support the use of that tool within state government.
Thank you, Senator. Are you ready for the question? The senator from Windsor is recognized.
Thank you, Madam President. I rise to support this resolution. This resolution is a call to action. I am profoundly disappointed after a terrific, exhibiting terrific and on really widely internationally respected leadership in our response to the pandemic. We are now, I find that our state leadership is sort of missing in action. And I think that I would just like to remind us that the case, the situation in this state goes, and why I feel strongly about this resolution is that the impact on our families, there is so much that is not a statistic. What is worsening is the impact on our parents. What is worsening is the impact on our children. Many things which are not stated in the statistics, the senator has already discussed. We have, it is having a profound impact, and we can affect and reduce that impact. And this resolution for me is a call to action. This resolution is helping us clarify that we are in a rough patch. We have the COVID outbreaks at school are sending kids home. Their schoolwork is interrupted. That is not a statistic. Parents' work schedules are being interrupted. That doesn't show up on a statistic. And we thought our vaccine wall would protect us, and it isn't. We have an opportunity here to have a statewide solution to this and to at least help us prevent further deaths and prevent further illness. We, for whatever reason, our governor, who has shown such respect for the science on this, is not moving forward, and this is very disappointing for us. We now have skyrocketing case counts, and we're calling on him to be the leader that we have come to expect. And I am just concerned about where our governor has gone and why his absence on this piece of our continued health in this state is where has Governor Scott gone. I think that I'm very grateful to all of us and to those willing to support this resolution, and I thank the body.
Thank you, Senator. Are you ready for the question? The senator from Orange is recognized, Senator McDonald.
Thank you, Madam Pro Tem.
President.
I owe you $1, Madam President.
This one's on the House.
Okay. We often digress into sports analogies, and I will ask to be tolerated doing that. Most of us have played baseball or softball at one time or another. And my grandfather always remarked that you can tell a good team when it backs up other players. And when I played baseball, I always tried to back up teammates, whether they were fielding or taking throws or, and I think that we've had a governor that has demonstrated that he has a golden glove, is a great fielder. But even great fielders sometimes let a ball go by. And I think the Senate and the legislature owe him what good teammates provide, and that's being backed up on an occasion when even a golden glover lets one go by. And that's what we're doing today on behalf of the people of this state And I'm proud to be a member of the team, which has involved our Golden Glove governor and the legislators who worked with him a year and a half ago to set this state on a course where we fielded pretty well and we caught pretty well, and now we're backing each other up once again. Thank you.
Thank you, Senator. Are you ready for the question?
Roll call.
I believe the senator from Rutland has requested a roll call vote. Are you ready? And we also have a senator from Rutland has her hand raised. So we will recognize the senator from Rutland, the other senator from Rutland, recognizing that the other senator from Rutland has requested a roll call vote. Senator Hooker, you're recognized.
Thank you, Madam President. Recently, the Rutland delegation had the privilege of meeting with the Secretary of the Agency of Human Services, Mike Smith, and with Dr. Levine from Public Health. And Mr. Smith, Secretary Smith, had a simple message for Vermonters. He said 3 things. He said, get vaccinated, get a booster, wear a mask. It seems to me that masking is something that we should take seriously. I know that, it's counterintuitive to think that we have such a high vaccination rate, and yet we are seeing a lot of infection. But the transmission rate is serious, and it comes from not wearing a mask. It comes from droplets. It's passed through the air. And it seems that this is what we need to do in order to break this cycle. So I'll be supporting this resolution. I would love to see a statewide guideline rather than doing what we're about to do with the bill that we're going to be discussing. And I just think that it is incumbent upon our leadership and our administration to look at the big picture. Masking helps to stop the transmission. Despite the fact that we've been vaccinated, we can still transmit this disease. So, thank you, Madam.
Thank you, Senator. Senators are kindly reminded to keep electronics silent. The senator from Rutland has requested a roll call vote. Are you ready for the question? The senator from Windham is recognized.
Thank you, Madam President. It's often said that where you stand depends on where you sit. And where I sit as a parent of children who have had to be sent home because of infections in the classroom, I stand with so many parents across the state right now. And I would assert that transmission rates right now are at emergency levels. We have families who are missing their work because they need to pick up children and be home with them to quarantine. We have childcare centers closing because of transmission rates. We have businesses who are short-staffed because of transmission rates. So while it is true that there may be other indications that we are in a stronger position than we were earlier in the pandemic, when I look at the transmission rates and what families are dealing with in my community, and what I hear from families across the state of Vermont is we have to get transmission rates under control in order to return to some semblance of normalcy. Thank you, Madam President.
Thank you, Senator. The senator from Rutland has requested a roll call vote. Are you ready for the question? The secretary is kindly asked to call the roll.
Senator Ballin.
Yes.
Senator Baruch.
Yes.
Senator Benning. No. Senator Bray.
Yes.
Senator Brock. No. Senator Campion.
Yes.
Senator Chittenden.
Nay.
Senator Clarkson.
Yes.
Senator Collmore.
No.
Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Hinsdale.
Yes.
Senator Hooker.
Yes.
Senator Ingalls,
No.
Senator Kitchell, Senator Lyons,
Yes.
Senator McDonald,
Yes.
Senator Mazza,
No.
Senator McCormick,
Yes.
Senator Nitka,
No.
Senator Parent,
No.
Senator Pearson,
Yes.
Senator Perschlick,
Yes.
Senator Polina,
Yes.
Senator Sears, Senator Soroskin,
Yes.
Senator Starr, Senator Starr,
Senator, kindly unmute.
Yes. Yes.
Senator Terenzini, Senator Westman,
No.
Senator White,
Yes.
Senator Kitchell, Senator Sears, Senator Terenzini,
Please listen to the results of your vote. The yeas 18, the nays 9, and you've adopted the resolution. We will now move to the one bill that we will take up today. We have one Senate bill for introduction, S1, an act relating to temporary municipal rules in response to COVID-19, introduced by Senator White. Please listen to the first reading of the bill.
S1, an act relating to temporary municipal rules in response to COVID-19.
Now you've heard the first reading of the bill, and the senator from Windham is recognized.
Thank you, Madam President. At this time, I move to suspend rules and not refer S1 to committee, and instead to take it up for immediate consideration.
The senator from Windham has moved that the rules be suspended and that S1 not be referred to committee and be taken up for immediate consideration. Are you ready for the question? Kindly unmute. All those in favor, please say aye.
Aye.
Those opposed, nay.
No.
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 The ayes appear to have it. The ayes do have it, and you've suspended the rules. You will not be sending S1 to committee, and you will now take it up for immediate consideration. We have on the calendar for action S1 introduced just now. Please listen to the second reading of the bill.
S1, an act relating to temporary municipal rules in response to COVID-19.
Chair of Government Operations, Senator White, is also the sponsor of the bill, is recognized for an explanation.
Thank you, Madam President. As everyone knows from our the past conversation that we just had, we are in the midst of a pandemic and our transmission rate is rising and it affects communities, different communities in different ways. This bill is very, very narrowly designed to allow towns to address the pandemic as it affects their jurisdiction by requiring masks in public places. First, let me say what this bill does not do. It does not establish a mask mandate. It does not require any town to do anything. It is only permissive. It does not address the efficacy or non-efficacy of masks. It does not deal with any of the issues of the virus itself. Now to the bill. Section 1 defines who this bill applies to. Municipality here is defined as a town, city, or incorporated village. It makes it very clear that it does not apply to schools. They are still under the jurisdiction of the school board. Oh no, that's in the next section. Sorry about that. It makes it very clear that this measure is in response to the COVID pandemic, nothing else. It gives the above listed municipalities, the town, city, or incorporated village, the authority to adopt a temporary rule to require individuals to wear face coverings while indoors at locations that are open to the public. The important words here are allow, temporary rule, indoors, and locations open to the public. It is also clear that any adopted rule, excuse me, does not apply to school buildings or school properties. They remain under the authority of the school board. A1 requires the legislative body to notice any regular or special meeting and to put it on their agenda if they intend to take this up. C2 waives the waiting time for such an adoption to become effective. It will take effect upon adoption. It also makes it clear that the adoption of such a rule is not subject to a petition for reconsideration. D requires the legislative body to meet a minimum of at least once every 45 days to reconsider any rule adopted under this section. They will have to vote to either extend or rescind the rule. Many of you may have heard from, I'm not sure where, the press, but I believe it's out there that it was 30 days. But in consideration of the holiday season, we have extended that to 45. Otherwise, towns may end up having to meet Christmas Eve in order to revote or on the rule. This authority and any rules adopted under it end on April 30th, 2022. A number of towns have reached out and asked for this authority, as has the VLCT. There are, of course, many towns who do not support this and have no intention of using this authority. Some are philosophically opposed. Some don't want to be put in the position of having to discuss it. Some are neutral. Some want the opportunity to discuss. And some expect to take it up and possibly act. Out of 251 towns, we can be assured that they are not of one mind on anything, including this. The VLCT realizes this, but supports giving the authority to those who want it, to exercise it. It probably mostly will be larger towns that are interested. They serve as hubs and especially see their numbers swell during these holiday seasons. They feel that by adopting this, it will set a standardized expectation of community behavior and people will obey. They will be able to have enforcement or not, depending on the town entirely. But the expectation is that they will have a standardized community behavior expectation and that most people in towns do comply with that. I hope we can pass this and give our towns permission to adopt rules to help protect lives in their communities. I can answer any particular questions that people might have, but this is, as I said, a very, very narrowly crafted bill that only gives permission. It does not require anything, and that's all it does, is gives permission. Thank you, Madam President.
Thank you, Senator. The question is, shall the bill be read a third time? Are you ready for the question? Senators are kindly asked to unmute. All those in favor, please say aye.
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 Those opposed, nay.
Oh.
The ayes appear to have it. The ayes do have it, and you've ordered third reading of S1. The senator from Windham is recognized.
Thank you, Madam President. At this time, we have a small amendment that we need to bring to the floor. I would like to ask for a brief recess.
The Senate will stand in a brief recess on the motion of the senator from Windham to consider amendment.